Parkview Health has collaborated with FEMA National Exercise Division. We started planning the exercise scenario really pretty early on in the exercise development. It took about 8 months to plan this whole exercise. FEMA brought on a real-world scenario that Northeast Indiana has conquered already. We focused on the 2022 Duratio event from Whitley County. Several Northeast Indiana counties were impacted by this Duratio event, from Allen County to Whitley County. Indiana Department of Homeland Security and FEMA came out to help support the damage assessment process. Parkview Whitley was able to stand strong and was able to help support any impacted patients that may have came in through the ED.
You know, when you look at the Parkview system, when you look at Northeast Indiana and the Fort Wayne area, we have to build capacity across all of our respective areas, and the healthcare system is part of that. You know, it's critical infrastructure. One of the things that we can look at is these types of drills are a process. It starts off with coming around a room and talking about who does what, when, and where. We call them workshops or tabletop exercises. The culmination of this drill puts everything into place, practicing the plans, making sure that everybody knows who's doing what, when, and where, but then most importantly, stressing the system. A good day is being able to identify where there's gaps so then they can close those gaps to be game day ready. Because it's that initial response, sustained response, and the recovery that really matters most, and that's in every single incident.
Every department has a different play scope. Today we're here at Parkview Regional Medical Center, where they're expected to receive anywhere from 59 patients to go through the clinical departments. Each department and each facility is a little different in terms of what to expect because of the magnitude of what they would actually receive in the real world incident. For PRMC specifically, the ED, the OR, registration, and others across the whole PRMC campus are involved in either acting as role players, treating patients, or even supporting the exercise as an evaluator or controller role.
The role of the Reunification Center really is in its day. We're trying to get families back connected with their loved ones. So you imagine if you're a parent or a friend or a family member and something happens, and if I know my kids, at the fair and there's this awful thing that happens, what I want to do is I want to find her as quickly as possible. I want to know where she is, and then we can move on to making sure that she's okay. So that's really our goal here, is to reconnect families and friends with the patients that come in during the mass casualty drill. We want a comfortable place for them to be. They got to be able to charge their phones, if they're trying to communicate and that sort of thing. It's not something you ever prepare for, so you want to have that connection to your loved ones, to the outside world, to see what's going on, and then just providing them information, making sure we've got things set up, we've got digital access to be able to communicate back and forth between us and the hospital, to give them that real-time update on how their loved ones are doing, and then just making it a comfortable environment, someplace that's welcoming, that's supportive of them while they're going through this. And so we got to see some of those things today, so that's really a success, right? We'll be ready, and I think because of the drill today, we'll be more ready than we've ever been.
It's truly an honor to be invited to this drill, but most importantly, it's truly an honor to see the dedication of all the staff members that came together. Local, state, federal partners, private sector partners coming together, nonprofit partners coming together to be able to build capacity that focuses on the residents, that makes sure that they can continue to provide the continuum of care that they would expect on any given day.
Parkview Health has been collaborating with our local responders across Northeast Indiana, and this should help prepare our coworkers and also give a reassurance to our citizens in Northeast Indiana that as Parkview Health Emergency Management, we are doing our part in preparing our coworkers for that rainy day.